Good evening. Hope you've all had a good day. Hopefully you can hear me okay as well. I'm just going to wait a couple of minutes to let a few more people filter in and then we will get started. Hi Ian, hi David. Fab. So a couple of you have now joined. For those of you who don't know, my name is Joni. I am the owner of the On Your Game Physiotherapy Clinic, and I'll be talking you through all things carpal tunnel today. So if you've got any experience with carpal tunnel, if you struggled with it before, or you know someone that does, then put a message in the comments here, just so that we can all kind of have a little discussion about that as well. So carpal tunnel can be a really debilitating condition for people because it not only causes pain, but it also causes neurological symptoms as well for people. So what happens is that there's a very narrow passageway in here which is formed by our carpal bones. So we've got 9 carpal bones that sit in here. I won't name them all for you, but what happens then is that we have a ligament that goes across our carpal bones. And that houses the median nerve and also tendons that help control our finger movement. So if you've got a small space and you've got nerves and you've got tendons that need to run alongside it, then what can happen is we can end up with compression of that area as well, or like narrowing of that tunnel. And that can then compress the median nerve. So if that nerve becomes compressed, that's often when we end up with pain, unfortunately. And today we'll be going through sort of what it is, the common risk factors that can cause it, recognising the symptoms and any interventions and prevention that we can do as well. But often carpal tunnel is caused by lots of repetitive hand and wrist movements. So that can be things like working on an assembly line, prolonged wrist flexion and extension. So we've got a flexion like this, we've got extension like that. Some kind of trauma could potentially cause narrowing of that area as well, and fractures, dislocations of course can cause trauma to that area as well. You're also more likely to develop carpal tunnel syndrome if you've got if you do lots of manual labour work, because often that's very repetitive. Please let me know if you're struggling to hear me. It's quite loud downstairs, sorry. Doing computer work as well, that can be one of the other problems, because lots of typing, and that's why your ergonomic setup is really important. So like when you're at home, making sure that if you're sitting at your desk, you're not doing this to type. You want to make sure that your forearms are in line or slightly lower, so you're typing like that and not like that, because if you're typing like this, what then happens is that's going to tense up this whole area, potentially narrow that tunnel, and you're going to end up with those symptoms that we were discussing before as well. But genetics actually also plays a role in this as well. So if there's family history, you are actually slightly more likely to get it as well, and that could just be down to your anatomy of that area. It might just mean that it's already a little bit more narrow than other people's, and also other health conditions as well. So diabetes, rheumatoid arthritis, that does make it more likely to get a condition like this too. So when we're looking at recognising the symptoms, obviously as physios it's really important for us to recognise the symptoms because that's our job, but for you it's important to recognise the symptoms so that you know when to get help for this as well. So obviously you can get pain into your wrist and into your hand, you can get numbness, tingling, often weakness in the hands and fingers as well. Typically we see it affecting the thumb, the index finger, the middle finger and half of the ring finger, but the baby finger is often unaffected. That's what we'll see in most people. What I will say is that nerve distribution is sort of follows the line of the textbooks for 80% of people, but for 20% of people it doesn't. So that means that for 20% of people there will be variation. My apologies. Hay fever. So for 20% of people there will be a variation in their nerve pathways. So don't be surprised if for some of you it might only be a couple of fingers that you feel in. For some of you it's all of them, because that's just a slight genetic difference. Typically we see that these symptoms do worsen at night, and often that's from like the way that we sleep. Lots of people like to sleep like that, and that's why actually one of the things that we sometimes put in place is wrist guards at night to keep it flat, because if you're keeping it flat and you're not allowing for that compression overnight, then that can make it feel better. And also you might notice things getting worse with lots of gripping or typing as well, and things like that. So the reason that you get weakness in the hand and the fingers is that our nerves supply not only our movement and our strength, but also our sensation. So that's why, because they supply our movement and our strength, because they tell the muscles that they need to work, they send the signals there. If that signal is interrupted as a result of being compressed, then you're going to end up with weakness, because the muscles are not going to be able to contract to their full extent, and then you're going to get the numbness sort of feeling, the pins and needles feeling, because that's a sensation deficit, and nerves also supply the skin for sensation as well. So they're typically the symptoms that you will notice. And to diagnose it, typically as a physio, we're going to look at your history, we're going to do a physical examination. Sometimes they'll do nerve conduction studies as well, so in hospital that's something that they can do, but it's typically not necessary, because we're gonna know from your symptoms anyway if that is the case. But nerve conduction studies are good to see just how bad, to see the extent of the damage to that nerve, or how much that nerve is being impacted. So yeah, like I said, you might be kept in a wrist splint at night, but you also might have to do that during the day with some people as well. And you want to just keep that wrist in a neutral position for those that are very aggravated. You might have the use of NSAIDs, so non-steroidal anti-inflammatory drugs. They can be really good for reducing the inflammation and the pain that you feel as well. Corticosteroid injections are another thing that can be used if you've got a lot of swelling in that area, but that's obviously not something that we want to be doing. And then for really bad cases you can get surgery as well. But they're all of our interventions that you'd have as like medical interventions and not physio interventions. So wrist guard, ibuprofen, potential surgery, but and corticosteroid injections. That's not what we want to be doing with you. What we want to be doing is our physiotherapy, because physiotherapy should be your first line of action for most injuries. With the exception of a really traumatic fracture that needs to be stabilised or something like that, physio should be the first thing that you are trying, because who wants to go through the risk of surgery and injections and that kind of thing? Particularly corticosteroid injections seem like a good idea at the time, but actually you can't really have more than 3 in one place, and that's because it can reduce the bone mineral density in that area. So particularly for females, we've got poorer bone mineral density anyway, we have more of a dip when we go through menopause, so it's not ideal to be using that as a treatment method really. So what we do as physios, we sort of address the contributing factors to help promote recovery. So anything that we feel like is aggravating it, we're like, what can we change here? What can we do to help improve this? So an example of that would be, like I was saying earlier, sitting at your desk. If you're typing like this, I'm going to change how you're doing it. If you're doing work that's particularly repetitive, we'll try and find ways around maybe not doing as much in the same day, using your other hand. And actually using your other hand for tasks is really good for your brain development as well. So that's something else that can help with your memory. It can help with keeping your brain young. It can actually help stave off dementia. So even brushing your teeth with the other hand can be really good for that. But sorry, that was a tangent and I digress. But we want to make sure that you're having sort of ergonomic modifications where you can to your desk setup or any tools that you can use. And for us as physios, we want to decrease your pain, improve your mobility, improve your strength, and reduce those nerve symptoms as well. So often we're going to be giving people exercises to strengthen up the hand, strengthen up the fingers, strengthen up the forearm, but we also want to be releasing off those muscles as well that might be tight, particularly if the flexor retinaculum, so this bit here, is tight. Then if we're loosening off all those flexor muscles here, then that can help, and that might be through massage, might be through acupuncture, might be through stretching, but that can give people some relief. The other thing that we want to do is be strengthening up the wrist muscles, so often that might be flexion, extension exercises, holding a weight or turning over and coming back like this, or we might just do it what we call isometrically, so just pushing against yourself, depending on how bad that person's symptoms are as well. And then nerve gliding exercises, so we want to promote the median nerve's mobility. We want to get it to move as much as we can. This is what we do with nerves, is we stretch nerves in a slightly different way to muscles. Muscles is often you kind of sustain a stretch, whereas a nerve kind of going to go like on and off with a stretch. It's kind of hard for me to show you on this video, but that's something that we find really beneficial, or I find very beneficial. So particularly if someone's having quite a flare up of their neural symptoms from their carpal tunnel, maybe it's because of something they've done at work or at home, I say to them, do these nerve glide exercises as like your lifesaver ones for when you need them, but also include them in your everyday exercise program as well. And the other things that we might do as well is sort of some hands-on manual therapy mobilizations as well, to help mobilize the wrist joint and get everything moving too. But typically, yeah, we work through our stages. Let's reduce your pain, improve your movement if that's what you're struggling with, increase your strength. So things that you can also do kind of like for self-care to help, you can incorporate into your daily routine, is if you're doing a repetitive task, take regular breaks. You really want to have as many breaks as you can to stretch and to rest hand and wrist in between. So as soon as you're getting to that threshold point where you think, I can feel my symptoms coming on, or it's aggravating my current symptoms, you want to then step back, have a 10-15 minute break, do some stretches, relax, then go back to it. Like I said before, wrist sprinting at night, that can be beneficial, particularly for those people that only struggle with it at night when they're sleeping like this. And then your work setup. If you're working from home now, your occupational health at your work, if you're in a big enough business, should be available to talk to get you a decent work setup. But if you'd like a PDF on how your desk should be set up at home, send me a message or comment underneath this work desk PDF, and I will send you a PDF with that. That's not a problem at all. Sometimes you can get ergonomic keyboards and mice as well, computer mice, where you might see like the gel cushion that you've got there, and that's because then it causes that motion over the top. And then some of the stretching exercises that I would give would often be ones like this, where you stretch and affects muscles, ones like that where you're stretching the extensor muscles as well. And then maintaining your overall health and fitness, that's the other thing too, because it's really easy to get into habits when you've got an injury of not doing as much as you were doing before because something is sore or painful, but actually it's really important to keep up with all of the other things that you were doing beforehand as much as you're able to. But if things that might exacerbate carpal tunnel, like being overweight or obese and diabetes, if you're trying to lose weight, then that's great, but if not, maybe that's something you want to consider if you need to. And then diabetes is going to reduce the healing time of any injury that you have, unfortunately. So particularly with things that are peripheral, which this is, the further away it is from the heart, the longer it's going to take to heal as well. So managing your diabetes, if you are diabetic and you've got carpal tunnel, is going to be really important too. So things that you can do to help prevent carpal tunnel would be to make sure you're maintaining a good posture when you're at your desk, when you're working, even if you're cooking or anything at home, so you've got good wrist alignment, and during your daily activities. Taking regular breaks from repetitive tasks. So like I said earlier, if you've got the injury, you've got carpal tunnel, you want to take regular breaks, but even if you don't, taking regular breaks will help to prevent it. And then using proper techniques like in sports as well. So, you know, if you're in the gym or if you play tennis or squash, some kind of like racket sport where you're also gripping quite hard, actually making sure that your technique is really good is going to put less strain through your wrist. If you think of our muscles and the way it's made up here, like our wrist joint's actually really quite small, and our muscles that lead up to it aren't as strong as other areas of the body. So it's something that you want to consider as well. Is actually good technique is going to be really important when you're in sport, and you're going to be more efficient then as well. And incorporating generally hand and wrist exercise into fitness routines, particularly if you know you're like to be susceptible to carpal tunnel based on maybe the work activities that you do. But if you add that in maybe as part of your warm-up or as part of a superset, just some basic strengthening ones. So imagine this is a bench, this is my hand on it, holding the weight like I showed you earlier, flexion, extension, and going supination, pronation like that. That will be really helpful in helping to prevent carpal tunnel in those that have had it and don't want to get it again, or those that think they're likely to get it as a result. So if anyone's got any questions, then post them now in the group. Now's the time to message me and ask anything. If not, you can always message me after this, or you can comment on here. But essentially, carpal tunnel is caused by the flexor retinaculum here compressing down on the median nerve. That median nerve can then cause these neuro symptoms in our thumb, index finger, middle finger, and half our ring finger. It can cause pain, it can cause weakness as well, so they're the symptoms to look out for. And if you do have it, then obviously as physios we're here to help. We can reduce the pain, we can get you back stronger, get you a bit more mobility as well. And if all else fails, there's always the corticosteroid option or the surgery option, but like I said, that's something that we don't want to go down. And then to prevent it, making sure that you're taking regular breaks, you're sitting at your desk correctly, and doing all of your sports techniques well. But yeah, it doesn't look like anyone's got any questions, but if this is something that you are struggling with, or you know someone else is struggling with, then please send them our way. We're more than happy to help them at any time. So give me a shout. But yeah, thank you very much for joining tonight. Have a lovely evening. Bye.